Welcome to the NewsRamp Health, Fitness, and Wellness Podcast. I'm your host, Max Newsman, eager to share today's top business stories with you. NewsRamp.com selects the latest news from leading sources, ensuring you get the most pertinent information. A quick reminder, this podcast is created with the help of AI and AI voices, but the stories we cover are entirely real. You can find the full news articles on NewsRamp.com. It's Tuesday morning, October 28th, 2025. And we've curated an intriguing lineup of health, fitness, and wellness news for you today. So whether you're in transit, at the gym, or at home, join us as we begin. Starting off with our first headline. GeoVax welcomes new IDSA guidance, highlighting need for tailored COVID-19 vaccines for immunocompromised patients. GeoVax Labs, Inc. highlights IDSA guidelines recommending tailored COVID-19 vaccines for immunocompromised patients. Over 40 million Americans at risk despite current vaccines. GeoCM04S1 vaccine, designed to provide broader, more durable protection by stimulating both antibody and T-cell immunity. Clinical studies show promising results with sustained neutralizing activity and favorable tolerability. IDSA panel acknowledges current vaccines offer incomplete and waning protection for immunocompromised individuals. GeoCM04S1's multi-antigen design addresses these shortfalls, offering durable cellular immunity, critical for long-term protection. GeoVax's focus on the needs of immunocompromised individuals has the potential to fill a significant gap in COVID-19 protection. Body clocks matter for heart health. Disruptions to circadian rhythms are strongly linked to health risks such as obesity, type 2 diabetes, high blood pressure, and cardiovascular disease. Factors like rotating schedules, irregular sleep, and light exposure at night can cause these disruptions. Optimizing circadian rhythms is key for preventing cardiometabolic issues. Behavioral interventions to regulate the body's schedule can improve circadian alignment and reduce risk. More research is needed to establish causality, identify optimal timing strategies, and develop personalized interventions based on a person's internal clock timing. The American Heart Association highlights the importance of circadian health in a new scientific statement, emphasizing the impact of disruptions on cardiovascular and metabolic health.
ACON Laboratories announces breakthrough 4-in-1 FlowFlex plus RSV plus Flu AB plus COVID home test. ACON Laboratories, Inc. unveils the groundbreaking FlowFlex plus RSV plus Flu AB plus COVID home test, the first FDA-cleared 4-in-1 respiratory home test. This over-the-counter rapid antigen test allows for at-home administration, providing comfort and privacy to consumers. Manufactured domestically in San Diego, CA, this test detects RSV, influenza A, influenza B, and COVID antigens. Notably, it is the first FDA-cleared RSV home test and authorized for children aged 6 to 23 months. VP of Sales and Marketing, Michael Lynch, emphasizes the importance of early treatment decisions for respiratory infections. The FlowFlex brand, known for its reliability, will make the new test widely available at major retailers soon. Natural Cure Labs, NCL, announces new Level Off formula featuring loquat leaf extract. Natural Cure Labs, also known as NCL, has announced the updated formula of Level Off, their metabolic support supplement. The new formula now includes loquat leaf extract, offering an upgraded antioxidant blend. This formula maintains NCL's clean label approach with no artificial colors, silica, magnesium stearate, or unnecessary fillers. Level Off was designed for healthy adults seeking support around post-meal metabolic response and energy balance. The new loquat leaf extract was chosen for its role in supporting normal post-meal responses, backed by over 10 published studies. NCL's founder and CEO, Damon Sunutnasuk, emphasized the company's commitment to improving their products based on customer feedback and scientific research. Level Off is not a substitute for medical care, but is intended to support metabolic wellness for adults seeking steadier energy and controlled post-meal responses.
Dr. Hos Loftus recognized as a 2025 Castle Connolly Top Doctor for excellence in neurology and psychology. Dr. Hos Loftus, a board-certified neurologist and founder of Carolina's Institute for Neurology and Psychology, has been recognized as a 2025 Castle Connolly Top Doctor for his excellence in neurology and psychology. Dr. Loftus established the institute with a vision to provide comprehensive, integrated care in Gaston and Cleveland counties. His practice offers essential diagnostic and therapeutic services in-house, including neurocognitive testing and advanced infusion treatments for Alzheimer's disease. Dr. Loftus's patient-centered philosophy combines thorough evaluations, evidence-based treatments, and the latest diagnostic technologies to provide individualized care. Top doctor designations are awarded through peer nominations and a rigorous review process by Castle Connolly. Connect with Carolina's Institute for Neurology and Psychology on social media for more information.
Q&A with Mark Weinberger, PhD, MPH, President and CEO, the IMA Group. This year marks the 35th anniversary of the IMA Group, IMA, a milestone that reflects both resilience and reinvention. Over the past 14 years, Mark Weinberger, President and CEO of IMA, and his team have grown the company from its roots in medical screenings and psychological evaluations into a national organization with more than 150 locations and a rapidly expanding clinical research network. A licensed psychologist and psychiatric epidemiologist, Mark combines scientific insight with business strategy, driven by the idea that when people have better data and clearer access to services, they make better decisions, whether they're patients, clients, or communities. IMA is a national leader in outsourced medical, psychological, and ancillary evaluations and screenings, serving government agencies, insurers, TPAs, and employers. For public safety programs, we deliver the psychological and medical assessments needed to evaluate police officers, firefighters, and other essential personnel. For workers' compensation, disability, injury, or auto liability claims, we support insurers and employers through independent medical exams, IMEs, medical file reviews, case management, and rehabilitation guidance. IMA operates more than 150 clinics across the country. The majority of these clinics support our core evaluation and screening services for government programs, employers, and insurers. Within that broader network, 19 locations, from New York and Chicago to Albuquerque, NM, and Hickory, NC, are dedicated research sites that conduct Phase 2-4 clinical trials. For sponsors, this combined footprint creates a powerful advantage, giving us the infrastructure to recruit diverse, representative patient populations more quickly and deliver high-quality data.
Thank you for joining us today. That's it for this episode of the NewsRamp Health, Fitness, and Wellness podcast. As a reminder, NewsRamp curates news from leading newswires like Newsworthy.ai, 24/7pressrelease.com, NewsDirect.com, and BlockchainWire.io. We encourage you to visit newsramp.com to read all of today's news.